But a lot of people actually, they can fall asleep, but then they're waking up several times at night. And that's what we're going to talk about
So we're going to
today.
talk about the causation of that.
That's
okay.
right.
Where are we starting?
Okay, well, we're starting at the top of your head, and we're talking about snoring. And this is really the bane of existence for many people. If they don't snore, maybe their spouse snores. So what's going on?
It's broken up quite a few relationships.
It has, right?
Yeah.
Now, that snoring sound, that happens when there's an obstruction in the back of your mouth by the tissues or the structures there, causing a vibration when air is passing through. But there are many causes. First of all, you said your husband, definitely more common in men than women.
Right.
It tends to get worse if people gain some weight. Alcohol can really play a role here because when you're drinking, you're relaxing the tissues in your throat.
Oh,
they're more
sure.
kind of
So it
loose.
becomes, right.
They're
So it
easier to
becomes looser.
vibrate. Exactly.
Yep.
But also if you have nasal congestion, if you have a lot of allergies at night, that's going to do it. Being sleep deprived, because if you're having a very heavy, deep sleep, again, more relaxation of those muscles and tissues in the throat. So all of these things can contribute to snoring. We know it's worse if you're on your back, which is why I don't know if you shove your husband on the side.
Oh, yes, I do.
Now, first of all, of course, trying to avoid alcohol, losing a little bit of weight. If you have nasal congestion, trying to get a decongestant or treating your allergies. But we have some cool devices here. So the first one is Nora. And this is right here. This is a cool new thing that really senses when you're snoring. It can hear it. And this part of the device actually goes underneath your pillow in your pillowcase, and it will slightly move so that you will, it's almost like you're shoving your husband, but very gently. This is doing that instead of you doing it. Yeah. All right, then now this is something called a CPAP machine. Now this is not for your...
I see these on TV a lot. This is for sleep apnea kind of patients, right?
So sleep apnea, this is not for your run-of-the-mill snoring, but if you are noticing that either you're very sleepy during the daytime, if someone who's sleeping with you has witnessed you stopping breathing for a few seconds, or you wake up choking, you might have sleep apnea. You really should get evaluated. That's a very serious condition, and you might use this machine in that case.
Which get easier to use and smaller, as I've seen over the last several years.
Yes, absolutely.
A little more
it used to be very cumbersome. You're
All right, let's move along.
Let's move along. Okay, another very common reason why people get up often to go in the middle of the night is to go to the bathroom. And we've all had that once or twice, but for some people it happens often. And here you can see we're talking about bladder issues. Now, if you drink too much caffeine, too much alcohol, this could be an issue. It could also be a symptom of diabetes or sometimes even heart problems. But one of the things that can happen very commonly for men is an enlarged prostate, especially as they get older.
As they get older, sure.
Right, and we can see here in this picture what happens when your prostate is getting larger. It's compressing the urethra. This is the tube that the urine comes out. So you're going to feel that sensation of needing to go to the bathroom more because you're not completely evacuating every time you go. So this is something really should be checked out by your doctor. Now, for women, of course, we don't have a prostate, but we can have bladder issues. Overactive bladder is another condition. And this is when your bladder's irritable. It makes you feel like you got to go. Some things that can help to avoid it, avoiding artificial sweeteners, hot, spicy food, or tomato sauce. For some women, that helps. But there are medications that can be used as well.
Yeah, well, I'm going to go a lot more because I'm not giving up either one of those.
All right.
Okay, now what are we talking about here?
So now we're moving down to the legs, to the bottom part of your body. And we're talking about restless leg syndrome.
My friend Donna developed this. She swears she has this restless leg syndrome. I'm like, oh, come on, that's not a thing. It's a real thing.
It's a real thing.
Yes.
So what it is you get this very uncomfortable sensation in your legs. You feel like you need to move them to get some relief. It can happen later in the afternoon or evening when you're laying down or sitting. And so for many people, it actually wakes them up at night. We're not exactly sure what causes it, but for some people, the theory is it might be an issue of something in the brain. So even though you're feeling it in your legs, it's a neurologic condition involved with dopamine. So this is one of the neurotransmitters. You see them being released here. And the dopamine levels are abnormal in the brain. That translates into these very restless legs. So for some people, it could be due to an iron deficiency. And for that reason, taking iron supplements may help with that. For other people, we have it right here. Other medications, prescription drugs can be used as well.
I've seen commercials for these. There's lots of new drugs for restless leg syndrome.
Exactly.
But they come with many warnings, of course.
Like all those commercials, yes. And then avoiding alcohol and caffeine right before bed or in the later part of the day can also help. But we have here something called Relaxis. So this is a device that's actually going to give you a little bit movement in the middle of the night, not enough to wake you up, but a lot of people with restless leg syndrome, they feel better if they go for a walk. This is like sort of, you don't have to walk.
Like the other device for your head, but for your legs.
It's exactly right. So giving you a little vibration, and hopefully that will trigger you to not need to
will you back into sleep.
Sleep and not moving your leg.
Very cool. Thank you, Dr. Raj. It's good to see you.